What are your options as a dentist if you work as an associate in a practice where you're just simply not busy enough and they don't have enough patients for you to generate enough income to support your lifestyle and your family and just in general make enough money to make the living? So if that's the case, you got a few options. One of the options is, of course, that you could just resign and go get a job. It just didn't work out. A lot of practices hire associates with the hope that they'll grow the practice and then the associate eventually will be busy enough. And it's just clear after a few months, the new doctor working there, that they just simply don't have enough patients to support another doctor full time. And a lot of the doctors, with all the student debt that they have now, they have to work full time to make enough money to support their lifestyle. They can't just be sitting around or working 1 to 2 days a week in hopes of that the practice will just simply take off and will be busy enough, and that oftentimes just don't happen. So then they just simply don't have anything to do all day. They're just kind of sitting in a practice, just not seeing any patients. So of course you can just resign and find another job. And I would make sure that the new job that they have is either somebody leaving who is working there full time, or the practice is booked out about 4 to 6 months. And that should be enough patients there to support you full time. Or if they have a dentist who actually leaving, who have been working full time, then you can take over their job. So that way you can be more sure that they'll have enough patients and enough work for you to support your lifestyle. So that's one. Two is you can learn a skill that you don't have right now, and it could be utilized in a practice because they have patients that they're referring for that procedure, but they're just not treating it in-house. So what are the examples for this? One of the best examples is what I like to talk about is orthodontics, okay? A lot of practices, a lot of general practices, they refer orthodontics out to a specialist out of the practice, and they lose that income because that is not an income generating procedure in the practice when you don't do it. So we teach orthodontics, we teach it for general dentists and specialists. We have a 2-year orthodontic program where you can learn orthodontics, braces, aligners, TMD, and sleep apnea treatment, and then you don't have to refer those patients out. So instead of you sitting in the office not busy enough, you could be seeing all these orthodontic patients. And as a general rule of thumb, it's a 1-to-1 ratio. So if a practice, let's say you have a practice that's doing about $1 million a year, usually in that practice, if you're referring all the orthodontics out, there is about $1 million of orthodontics in the practice. It's usually about a 1-to-1 ratio. If you have a practice that's doing about $500,000 of revenues a year, there's about $500,000 of orthodontics in that practice. I'm not talking about patients who are asking you for orthodontics. I'm talking about patients who actually would be excited about orthodontics and could use orthodontics and could be excited about it if you would talk to them. A lot of orthodontic patients actually don't even think it's an option. Let me give you an example. A patient has a lot of class 2 and an overjet, and he or she loses a tooth on one side and a lot of crowding. Instead of putting an implant in and leaving everything crowded in class 2, maybe you could take out the same premolar on the other side, especially if it has a large filling and it's a really broken down tooth, close all the spaces, and actually it would be a cheaper solution for the patient, and they would end up getting an implant and surgery and bone graft and things like that, and they would end up with no overjet, nice class 1 occlusion, and no crowding. So at the end, they would have a beautiful smile and they never needed an implant. So these are all the patients that you're not even possibly considering in your practice right now that you could be doing all these orthodontic treatment on. And it's not just orthodontics, it's also TMD treatment and sleep apnea treatment, and we also teach myofunctional therapy as part of the program. So obviously it would take a little investment. It would take you probably about a year to kind of get going with this, but as soon as you start a program, you could maybe start doing phase 1 cases. Most of the phase 1 cases which you do for children around 7, 8, 9 years old is just an expansion with some brackets and maybe a utility arch. If they're class 3, maybe a face mask to bring the maxilla forward. But they're fairly simple, straightforward treatments that you can actually do pretty early on in your training. So that's one option. The second option is surgery. You could start, you could enroll in an implant fellowship and learn to do how to place implants and implant overdentures and there's all kinds of possibilities, especially if you don't do implant procedures in a practice right now. So you could be utilizing all those procedures. One thing I love about orthodontics is that it's something positive. It's something that patients want. It's something that patients are looking for. It's something that patients are excited about. So I think it's a great option. So these are some of the best options really to get busy if you're not if you are in a practice where you're just simply not seeing enough patients. Okay, so hopefully this helps, and have a good day. Bye.